Hi, Dr. Hart.
Hi, Daryl. How are you?
I'm good. Hope you are too. Can you tell then welcome to our conference. Can you tell our audience what you do and where you do it?
Absolutely. I am a clinical psychologist and a researcher, and I live in Toronto, in Canada. And I have a couple of different positions. I've been working at a place called the Zane Cohen Center for Digestive Diseases at Mount Sinai Hospital, running a small program on how people live with and cope with a hereditary type of cancer called Lynch syndrome, which is primarily, I know we're talking about prostate cancer today, but that is a genetic mutation that mostly leads to colorectal cancer, and for women, both colorectal cancer and certain kinds of gynecologic cancers, plus many other kinds. So I'm involved in the world of hereditary cancer, but I've been working in psychosocial oncology since 1991. And I also am a professor at a university called Toronto Metropolitan University, which is in downtown Toronto. And I have a small private practice where I mostly work with people who have been diagnosed with cancer.
Right, and you've written a number of papers regarding gay men and prostate cancer, and you're part of our small world of colleagues who have been focusing on this field for over 2 decades or close to. So we're delighted that you're here. I'm really happy that you're part of the show, so to speak, because we're gathering all our friends to be speakers for this. Um, so the scenario is two guys walk into an office and one of them's got prostate cancer. They're both partnered or married. Prior to that, the worst health issue was like a broken molar in their mouth or something. What do you think the internal conversations like for the guy who's not diagnosed and the partner or husband who is diagnosed?
So I'll start with the person who's been diagnosed. Depending on how old is our couple, and what age range are we looking at?
So we're going to say we're going to give a really broad swath here. We'll say 50 to 70.
Yeah. So 50, I'm also in my 50s, and this is the age range when people start to get diagnosed with cancer. This is when our friends and our family members that we really care about start to get diagnosed with cancer. And I think for the person that's just been diagnosed, it's a wake-up call in not a good way, to realize, am I actually going to make it? What are the treatments I'm going to have? And there's so many choices that men with prostate cancer have to make. That's a big burden. And then what side effects am I willing to live with? And then I think there's the whole emotional existential component of it. Even if you have early stage prostate cancer, there's still those questions about how long do I have left? And what am I doing with my life? I think for a lot of gay men, the piece about sex is critical. So am I going to be able to have a healthy sex life in the exact way that I was having it, in the way that I want to? And so I think for partners, a lot of the conversations can focus around sex or not, depending on the communication style of the couple. But I think that one of the most complicated things for couples is, how much does my partner need who's been diagnosed? And what do I do with my needs as the person that's not diagnosed? And I find that there's kind of this fine edge, especially when I do couples therapy, where you're not giving me enough support, or you're talking way too much about cancer, stop talking about cancer. And it's impossible to know what the right mix and the right balance is if the couple isn't communicating, especially if the person that's been diagnosed isn't saying like, I really need to talk today, or you were talking way too much about this, I need to not talk about it. So I find that that's one of the biggest challenges that couples have is the piece about how much support, how you're talking too much about it, like that fine edge between those two things.
Yeah, and the idea that death is now within the couple, the for I mean, the man diagnosed fears his own death, his own passing, but the man who is not yet diagnosed, um, is wondering, is he going to be alone or not? And for gay men, that's a different kind of concern than usually heterosexual couples face. Can you talk about that a bit?
Absolutely. And I think for people that, started, especially people that are in this 50 to 70-year-old range, there is a particular kind of HIV AIDS trauma that we all carry. Me too. Um, and we don't talk about it very much anymore, but it is there with us. We remember. And so the idea that death is on the horizon has always, it's true for everyone, but it's how much do we access those thoughts on a day-to-day basis is not as frequent after a diagnosis of cancer, right? The before time. So it's not weird or unusual that a lot of the HIV AIDS grief gets reactivated with a diagnosis of prostate cancer for people, especially in this age range. I don't see it in younger people. So I think that that's kind of a piece of it too. And then I think there's a very particular way that age is handled for us as queer people, especially for gay and bi men, that if I'm partnered now, that's great. But, if I'm unpartnered, how do I start all over again? How am I going to be desirable at an older age? And I mean, the answer is yes, but I think that the feeling is no. Do you know what I mean? Like the internal feeling is no, but it's actually, I think that I think it's hard to lose a partner, and I think it's hard to start dating again. And so I think the best thing for couples to do is to honor the fact that they're having these thoughts and worries about the future, but that isn't happening right now in this moment, at least in this scenario that you've laid out for me.
Yeah. Having survived the HIV crisis, the decade and a half at the very least we could fashion as like a period of crisis, prior to novel therapies that sort of made it a bit more understandable and manageable, the idea of coping skills comes into play. I mean, you've survived HIV. What did you learn from that survival that you could now use for prostate cancer?
I think I love that you're asking about this because you're talking about resilience. And we are a resilient group. We are a resilient group. We've lived through something that straight people haven't lived through. And I include myself in this, right? Because my early years were through ACT UP and Queer Nation, and having lost a lot of close young friends in my early 20s. So I think that resilience is, I talked a little bit about trauma, but I think that the piece about resilience is really important. And what's available now to gay men dealing with prostate cancer is the internet, is support, is actual treatments that likely are going to keep you quite alive and as healthy as possible, and lots of rehab to help you deal with the symptoms. So there's a lot of supports in place, but I also think that we do have an inner reserve that we need to draw on. And if that isn't happening, and coping doesn't feel as strong as it could for that couple, that there's a lot of support in terms of psychological support, social work, psychotherapy, couples therapy, to help people deal with whatever feelings are coming up, and also panic and fear around the future.
Yeah. And the male care support groups sort of reinforce all of that.
You bet.
Yeah. The idea also resilience, three cheers for that, but then there's the idea of also revisiting death and disease. Um, which does that defeat resilience or create a barrier to using the learned strategies from the 80s and 90s?
No, I don't think so at all. I think that one of the things that is very, very, it comes to bite people back is pushing down grief, ignoring, suppressing. I think that those are really good short-term strategies that are effective in the moment. The problem is that when you have a lot of unprocessed grief, it just always shows up. It's like an unwanted visitor that just keeps coming around. Because you never really, in order to get out of it, you have to go through it. And so I don't think that those two things work. They may feel like they work opposite to each other, but I actually think that dealing with grief is a way that people make themselves stronger. And finding that you can cope with grief is a sense of, I think it builds trust with yourself. And
Y-
we live in a world where we are not supposed to grieve. Like, did your dog die? You have 2 weeks. Did your mother or partner die? Oh, you have 2 weeks. We treat every death as if they are kind of the same trajectory. And by the way, the 2 weeks is, I'm being euphemistic about it, but just think about any time you've gone to work and something bad has happened, and people are usually sympathetic for around 2 weeks. And after that, nobody really wants to hear about it. That's not a function of the workplace. That's a function of our society, that we have a grief and death denying society. So I encourage people to kind of go into it and to deal with it. And if you can't deal with it, there's a lot of support to help you deal with it.
Yeah. For the undiagnosed guy, there inevitably a fear of what to say to the person that he loves. The man, his husband or partner who's diagnosed with prostate cancer. What are the specific strategies or sentences that you could offer our audience? And there are 1,000 people sitting behind me virtually. What are the things that people could say to each other?
Well, I think that this is sort of a generic, but it it generally feels good to people and couples to talk about cancer as a we illness, like as something that we are doing together. I think it's also important to be careful to say, I didn't get diagnosed and I can't possibly know what it feels like to be in your body, but we got this. I'm here for you. I want to be here for you. And I want to keep the communication lines open to, because your thoughts and feelings might change day to day, week to week about what you need and what you want. And I also want us to find ways to continue to have joy in our relationship and things to look forward to.
Yeah, and good that you mentioned joy. It's almost easy to say we're going to talk about cancer, at least in our heads, like because it's there. It's not an elephant in the room. It's the room. It's now the new reality. We're living in this cancerous kind of environment. Somebody's got a diagnosis in the household. But it's about life is about joy, and you are partnered with the guy or married to the guy because you love him, and you enjoy having sex with him, and you enjoy holding hands and hugging and snuggling and doing things, whether it's a walk to the grocery store or a walk to Kilimanjaro, so it's about reinvesting and reactivating whatever joy you might have lost on the day you heard that somebody got diagnosed in your family. Does that make sense?
100%. 100%. I think that cancer has the ability to literally encroach on all areas of your life, not just physically, but emotionally, spiritually, socially. And um, it's important to make space for it, but it's also important to not let it take over and to continue to do the things that you like to do to the extent that you're able to do them while you're under treatment. But that it's important for the couple to stay connected in the ways that are meaningful to them as a couple.
As we talk about chronic illnesses, we look to breast cancer, and we now know, I mean, we know intellectually, but I think we now know as society, men get breast cancer too. So whether you're heterosexual or homosexual, it's entirely likely possible for a couple to both have breast cancer. Uniquely for prostate cancer, a couple in our community can have prostate cancer, both guys, both husbands. In the time we have remaining, can you talk a bit about what that kind of conversation and dynamic might be like for two men diagnosed?
Yeah, I think that is an interesting question, because what you're dealing with then in that moment is that you're no longer, I'm the patient, you're the caregiver, and you're moving into, we both have a chronic illness, which might or might not lead to something much worse in the future. Mostly not, but it could. I like this question, because this is actually the truth for every aging couple. Nobody wants to talk about that, but we are all going to die. We are all going to get something that's going to kill us eventually. That's for sure. Death is out there somewhere, and that's a guarantee. So then for two people to be dealing with something that could or could not be life-threatening is a lot. And it's a lot to deal with what I would call like competing demands. But couples always have competing demands. This one's just around cancer. And I think that the important thing for a couple in that situation to consider is, what I need is not necessarily what you need. And there may be a sense that we should be doing the same things. We should be choosing the same treatments. We should be having the same side effects, maybe from the same treatments. There may be a sense of dismay if one person's symptomatic and the other person's not. And then also, one person may have a much easier time processing it and the other one may not, or both of them may not talk about it at all. So it's really about how complementary the couple is in their coping. I think the most important thing to realize in that scenario is you're not going to need the same things, and that is completely okay.
Yeah. And I love the word complementary. I mean, the semiotic understanding of it, a compliment, a nice thing, we're saying nice things about each other. We're fulfilling niches that the other person has so that both of us can be complete. We're finding, returning to a previous, we're finding ways to enjoy life together. And yeah, I mean, within the scenario of a 50 to 70-year-old guy, and now the man he loves is sharing the same disease, um, death is around the corner, but we're going to go down that journey and around the corner together, you know. Um, it's complementary, as all things are in our coupled lives. And for that, I thank you for this conversation. It's, I think, a good starter for anyone listening to this to share this video, this discussion with your partner and husband. And now I invite all of our all of our listeners, watchers, conference goers to go get a cup of coffee or tea or beer or glass of water or whatever you'd like quenching your thirst with, and sit around for 20 or 30 minutes purposefully and just talk about what you just heard, and talk about your life together. And if you want, talk about your cancer.
Absolutely.
Dr. Hart, thank you for being part of our conference. Thank you for you're now welcome to Mailcare's faculty. And thank you for your colleagueship over the years.
You bet. Thank you, Daryl.
Okay.